Following prostate biopsy, results are typically available in approximately 72 hours. In the event that the findings indicate benign conditions in the prostate, it is usually recommended that the patient have a follow-up blood test and another examination in 6 to 12 months. If there are areas of prostate cancer, this is when it becomes very important to get the best diagnostic information in order to provide good counseling for a patient. If there is cancer found, the pathologist will grade the cancer based on its microscopic appearance, which allows us to have a general idea about the risk that this cancer might pose for the patient. Prostate cancer is a spectrum of disease, ranging from low risk or even very low risk prostate cancer to aggressive prostate cancer. Fortunately, most prostate cancers fall into the low risk or intermediate risk category. Recently, we have also sent prostate cancer biopsy samples for additional testing. This testing allows for the determination of the genetic material and how it might correlate with risk. Commonly used tests are called Oncotype DX or Decipher, and it is very important that this testing be done on any abnormal biopsy. The reason for this is in low-risk prostate cancer, a patient may be suitably observed without the need for immediate treatment. This is commonly referred to as active surveillance. In other cases where the prostate cancer has more concerning characteristics, the genetic testing can allow us to counsel patients about the suitability for less invasive or more aggressive therapy as the initial appropriate first step. Oftentimes, when a patient looks at a biopsy report, he will see the term Gleason score. Dr. Gleason was a pathologist who came up with a system many years ago to grade the potential aggressiveness of the cancer based on its appearance under the microscope. We typically see Gleason scores between 6 and 10. Gleason 6 is usually low-risk prostate cancer that can be followed with active surveillance. Gleason 7 prostate cancer exists in two forms, and in most cases, these cancers call for treatment. Gleason 8, 9, and 10 prostate cancers are potentially more aggressive, and additional diagnostic testing and imaging to assess for prostate cancer spread, as well as a discussion of more traditional whole gland radical therapy can be instituted in these patients. Fortunately, most prostate cancers are low to intermediate risk.